But anyway, I'd like to welcome Don Emerson, who is assistant professor in what's it called? Kinesiology and
all the things.
And a bunch of things, but kinesiology. She's interested in becoming affiliated with the Institute. So this is her presentation to tell us what she does and how that might relate to what we do. And she'll be talking about surviving the sun. Really interesting.
Thank you. Thank you. Thank you. Thank you all so much for coming. Thank you to those who are online and joining. I'm very excited to be able to talk to you today a little bit about some of the research that I do, and also how I hope to be able to collaborate with individuals with the Climate Change Institute. So first, a little bit about me. I'm an athletic trainer. So if you're not familiar with an athletic trainer is, it's underneath the sports medicine umbrella. So we take care of physically active populations. That could be sports, any level, youth, all the way up to professional. That could be military, law enforcement, performing arts, NASCAR. Like we're in a whole host of different clinics and working with physically active individuals on prevention of injuries. That could be orthopedic, musculoskeletal things like sprains and strains and fractures, all the way to primary care type things like diabetes, skin conditions. So we have a very wide range of expertise that we work with, and we work underneath physicians to provide this care. And we also deal with emergency type situations. So from my perspective, heat stroke being an emergency, like potentially fatal condition, but also cardiac issues, concussions, spinal cord injuries. So we have, again, a very wide range. I went to the University of Alabama for my undergrad when we were not good at football, so that was not exciting. And then I got my undergraduate degree in athletic training. I got my master's degree in physical education, athletic training at the University of South Carolina, and I stayed there to get my PhD. My PhD is in exercise physiology, just always really interested in how the human body works and the things that impact the human body. I then spent 7 years at the University of Kansas. I was working with the athletic training program and exercise science programs at the University of Kansas for 7 years. Then I went back to the University of South Carolina, where I was for the last 3 years until about 2 months ago when I moved to Maine. So very excited to be here in Maine. It's the Climate Change Institute was actually something that kind of drew me to this area and this position, and also being just kind of closer to family and a lot of other things. So my family and I are excited to be here. A little bit more in terms of my teaching expertise. I've been predominantly teaching in athletic training, and I do teach more of the emergency care type situations, also primary care. I'm really interested in general medical stuff, which sort of leads me to the impact on human health that we're going to talk about today. I've also been really interested in pharmacology and sort of understanding how medications affect the human body. So many of the medications that individuals need to take have a lot of side effects, and that can impact their health and other complications, particularly during exercise. I've been doing heat illness, specifically that research, since I was a master's student. I had some really great mentors that I knew nothing about heat and was kind of scared and nervous about research, and then fell in love with trying to understand more about how do we prevent individuals from getting heat illnesses. And I have the very fortunate opportunity to be able to volunteer with the Boston Marathon. I'm a medical volunteer for them, have been for quite a few years. And I work in what's called the heat deck. And that's where we treat all the heat stroke runners. So all of the runners that come with heat strokes, they come and they bring them to us, and that's where we take care of those individuals. So we work with physicians, physical therapists, nurses to be able to treat those individuals. So knowing that we all have a very wide range of expertise, I wanted to sort of just talk a little bit about what heat illnesses are and just kind of introduce this topic area before I talk a little bit more specifically about my research area. When we talk about heat illnesses, the easiest, mildest one is heat syncope. And that's essentially when the blood pools down in the feet, lower extremity, and then the person faints. And that's the body's attempt to try to get blood back to the brain. And so once that happens, they're usually fine and they can go on. So it's not really something that will hold them out. Heat exhaustion is going to be a little bit more serious. This is that individual who's really starting to feel very sick when they're exercising or doing work. It could be doing yard work outside, mowing the lawn, something like that. But they start to get a headache, they're starting to feel nauseous, they're sweating profusely, they just don't feel well. The important piece about this is that they do have a higher core temperature, but they have what we call normal central nervous system function. And that means that they're able to talk to you and have a conversation with you. They know who they are, where they are, what's going on. They just don't feel well. So If that person ignores those signs and symptoms that they're not feeling well and continues to push, that's where we see that individual get into the more potentially fatal heat stroke. So heat stroke is a medical emergency. It's when the core temperature is generally, we define as above 104.5. And this sort of critical temperature where that person can no longer function appropriately, and we start to see cell deaths and organ damage and things like that. For this individual, their central nervous system is not normal. So this person generally doesn't know who they are, where they are. They don't know what's happening. They're acting very odd. They don't have normal behavior. And we need to try to get their core temperature down as quickly as we can. Otherwise, they're going to have some long-term health consequences, long-term like liver damage, kidney damage. Some individuals who don't get treated appropriately have to have organ transplants, have a hard time being even in the heat after that, and again, potentially fatal condition. Now, there is a difference between what we would call exertional and passive heat stroke. So passive heat stroke is kind of typically what we think about when heat waves come around. It's those individuals who maybe don't have access to air conditioning, are elderly individuals who are maybe kind of confined to their home, not able to get to cooler areas, maybe don't have resources, they don't have the things that they need to be able to make it through this hot temperature. Or individuals who unfortunately, like children who might get left in cars, that's passive heat stroke. It's really a strain from the external environment and how hot it is outside, versus exertional, which is somebody who's doing physical activity. So that could be like the pictures here, the firefighters, the construction worker, the football player, the person doing yard work. They're actually doing physical exertion. And what's happening is that the metabolic heat that's being produced by their muscles is driving their core temperature up. And so that's a different physiological mechanism that's happening, that's causing that person to increase the core temperature versus that passive heat that we would get from the environment. They differ a little bit in the signs and symptoms as well, but sort of understanding, well, what's driving that person's core temperature up is important. But either way, we have to get them cooled off as quickly as possible. So oftentimes some people, after they experience a heat stroke specifically or heat exhaustion, they're like, I don't understand why that happened. It was really cold outside. Like, I didn't expect this to occur. I've been hydrating. I'm really physically fit. Like, why did this happen? And what we find is that heat stroke is very unique. You can have a whole football team on the field and one person gets a heat stroke. So what is it about that one person that was unique to them and those factors that played into them getting it? And that's sort of where I became really interested in understanding a little bit more about risk factors. So anything, whether it's diet, nutrition, sleep, medication, an underlying health condition that affects physiological function, whether it's cardiac, so that's really important for our ability to thermoregulate, it's their ability to sweat, maybe it's their gastrointestinal and immune system, like anything that affects those systems is going to potentially increase their risk for a heat illness. And we see that in all of these cases over here on the right-hand side. The second one, the exertional heat stroke during a cool weather marathon, it was like 50 degrees outside and this person had a heat stroke. And what ended up happening was that they had been sick right before that and still weren't feeling well. So there's these risk factors these individuals come into these events with that really drive that heat stroke. Sort of the perfect storm of all these factors. So that leads me to my kind of previous and current research, really exploring these risk factors. There's a lot of research out there to say these are the risk factors for heat illness, but we don't necessarily have a really good understanding of it. And especially in some of our like diverse populations outside of just football and soccer, like all the sports that everybody's been doing the research in, we need to try to look beyond those kind of traditional populations and explore more about the general population or just underrepresented groups. So the first study that I was involved with related to heat illness risk factors was during my doctorate work at South Carolina, and Dr. Jurgen was working on a youth football study, really trying to look at risk factors between age and weight restricted youth football. There were when you talk about weight restricted and you're talking about youth and like you're already asking them to cut weight, and that comes with a lot of negative side effects when we're asking them to restrict their weight. So we wanted to kind of explore this a little bit more. And that led into my dissertation work where I was looking at specifically naproxen. So NSAIDs are non-steroidal anti-inflammatory drugs like Aleve, Advil, your ibuprofen, aspirin, things like that are incredibly common medications for athletes as well as the general public. They're one of the most utilized medications. And they also come with a number of side effects. they damage the gastrointestinal tract, they affect how the kidneys work, and because of that, they can potentially increase that risk for heat illness. So I was able to work on this study of my dissertation, and that led to the systematic review that I did to really kind of understand, like, what do we know about these medications? Like, they're so commonly used. How are they affecting it? There's also this misconception that if it's an anti-inflammatory, would it bring down your core temperature? And that's not how it works, because it also causes so much damage to the gut and the immune system that if anything, you're just breaking even. It's not actually helping. But they did find some, like in older populations who are usually taking aspirin, like daily dose aspirin, or your law enforcement, fire, who are often at higher risk for cardiac issues, that those individuals might be more susceptible to heat illness because of these NSAIDs. But a lot more research needs to be done in this particular area. I was in marching band in high school and in college a little bit, and it's actually when I first saw heat illness, and it's something that people they usually pay attention to the marching band, like no one's paying attention to all the health issues that they have. And so when I became a faculty member and I got to do like the research that I wanted to do, then I was like, okay, I want to raise awareness about this. And the whole point has always been to raise awareness about heat illness and health concerns in general in the marching band. And advocate for them to have access to athletic trainers or healthcare providers that are able to provide care to them based off of their needs. But also the really unique thing about marching band artists is that they're the general student body, right? So like athletes who are able to participate in sport have so many resources. They get screened for health concerns. They have access to healthcare at all times, but the marching band members are just general students who want to participate. So they often don't get screened. The band directors don't really know what's going on with them from a health perspective. And so this first study that we did, I was at KU at the time, and we looked at just core temperature. We just want to know how hot do they actually get. And we did find that they got as hot as football players. So they're working as hard and doing as much as we see in our traditional sport athletes. And so we wanted to raise awareness about that and also look at some of those risk factors. I'm going to come back to this study on the self-reported exertional heat illness and talk a little bit about those risk factors in just a moment. But I do want to highlight something that we found in our first study. Now, from an athletic standpoint, we use wet bulb low temperature to help modify activity. So if it's above a certain temperature, we will then modify activity. How hard are they going? For how long are they able to be out there? And what clothing are they allowed to wear? And we use that in this particular study to say, like, okay, well, based off of the wet bulb low temperature that we did take, and we used a range that we reported, what were maybe the recommendations on what they should have done? And that's that far right hand side. Those are the recommended activity guidelines that should have been taking place if they had been following them. And you'll see there are a number of days that were black and that they should not have been out there, but they were. And so part of the challenge is that some of these are games, and it's football. This was SEC football and whatever the Big 10, 12, whatever we were at the time. So it's dictated by TV, it's dictated by things that can't be changed. So the band can't say like, hey, it's too hot, we're not going to be out there. They have to be out there. But there were some days that they could have adjusted their rehearsals, and what we wanted to show them was we tracked how many water breaks they had, we tracked how long they went, and at no point in time did they meet the recommendations that should have been out there. And the other thing was these two games down here for this second marching band was actually at KU. KU at the time had, so if you're not familiar with marching band, they're dressed like head to toe in uniform. They have shorts, t-shirt, but then they have these overalls on, they have a jacket, hat, all the things. KU had an alternative uniform. For hot days, they could wear shorts and they could wear a polo shirt, but they could only do that for one game. And so the first game was very hot. It got pretty high. And that second game, since they had already worn their alternative uniform, they had to be in full uniform, and it was even hotter. So you'll see 51 Celsius, the wet bulb low temperature. It was incredibly hot. And there was a lot of sick people that day. They got very, very hot. And so what kind of came out of this and why I wanted to talk about this is that this was kind of the first study and where we really achieved like immediate results. Like, were we able to change policy and we were able to help them develop more prevention. So that first band, the South Carolina band actually has an athletic trainer, but they were able to take this and say, hey, we need to follow wet bulb low temperature guidelines. If we need to utilize these more, this is how we should set up our rehearsals. And then that second band, the KU band, they were able to take this and advocate for athletic training services, to have someone there during band camp or games. They were able to advocate for them to be able to change that 1 game rule. So now that if it's ever above a certain temperature, now they're able to wear their alternative uniforms. And it was just a fantastic opportunity to get some, again, policy changes to be able to improve the health and well-being of those marching band artists. Kind of currently what we're working on right now is working on acclimatization protocols of the marching band. This is the uniform that you can see here on the right-hand side. Oftentimes what happens is that they rehearse in shorts and t-shirts, and then they will go to the game, and the game is the first time they wear their uniform. And so they've not worn it before then, and now we've had all this added heat strain. So what we wanted to try to do was propose a heat acclimatization to the uniforms. How do we get them used to that attire? Now, most marching bands are not going to want them to wear their uniforms during band camp or during rehearsals because they get really dirty. Those white pants are not going to stay white for very long. So we wanted to come up with like a mock or alternative uniform. What could they wear to mimic the heat strain so that they were more comfortable with it when the game days came? Now, from a physiological standpoint, when we looked at core temperature and heart rate and skin temperature, we didn't necessarily see significant changes between our groups, but the perceptual changes that we saw in the individuals who were in the mock and the uniform group, they felt much better on game day. They felt more prepared. They felt like they were able to handle the heat better. So perceptually, they were able to have a better experience on that day, even if we didn't necessarily see the physiological changes that we expected. So I mentioned I was going to come back to this self-reported exertional heat illness and risk factors. My doctoral student at the time sent a survey out to band members across the country because we wanted to basically, we did study in 2 bands, but there's bands all over the country. So is heat illness something that is happening all over? And what we found was out of the 1,200 individuals who responded, half of them had experienced an exertional heat illness at some point in time, whether it was maybe high school or college. And it included both heat exhaustion and heat strokes. We had 31 cases, it was all self-reported, so I understand some of the limitations of self-reported, but it was a start in raising awareness that this is a concern. The other thing we really wanted to do with this study is raise awareness about all the underlying health concerns that the individuals are coming in with. So going back to the fact that these are general student body, they come in with different health conditions and different medications that they're on. And I know this is small, I'm gonna blow it up in just a moment. This particular table is showing us the different mental health conditions that the individuals were diagnosed with. So we have individuals who were diagnosed and self-reported that they had ADHD, anxiety, depression. And then we also asked them about all the medications that they took. And what we found was a pretty significant number of them were associated with having a previous exertional heat illness. So they were self-reporting that they had mental health conditions, that they were taking mental health meds, and that this was also associated with them having any heat illness or maybe heat exhaustion and heat stroke. And this was the first time that I started to get really interested in like, well, what's happening? And it kind of led me into this climate discussion. So the research that we have right now to show any kind of link between mental health medications and heat illness is all during like heat waves and individuals who are reporting to the hospitals. And they're taking medical information and that they're finding that they're on these medications. So they're finding that they're taking the antidepressants or they're taking the anti-anxiety medications. ADHD has been one that's been known for a while, that it increases the risk for heat stroke. It's a stimulant, so it's increasing that cardiac demand. And so that's been something we've known, but we haven't really seen this in physically active populations. And so I started reading more about it and getting really interested in like, if this is what we're seeing in the general public, that they're taking these medications and coming in like during heat waves again and getting sick and increasing the chance of having that heat illness, then we need to be paying attention to that. We saw similar things when we looked at other medications. So taking either cardiac or gastrointestinal medications, allergy, asthma medications, we saw several associations. And so it's not just the mental health meds, it's the cardiac meds as well. Individuals who are taking maybe hypertensive medications, taking that daily aspirin, that kind of stuff. So this sort of sparked my interest in exploring more about the climate aspect. The other thing is that most of the research we've done has been in predominantly white institutions. And so this past year, we did a study with a historically Black college and university, understanding that those individuals may have some unique risk factors that we don't see in our more predominantly white population. So like higher risk of diabetes and cardiovascular disease, other metabolic health concerns. And so we wanted to see maybe there are some unique factors here. We did see a lot of the same types of categories, so that they are coming in with inadequate sleep, that they're coming in maybe not as hydrated, that they have underlying health concerns, but some of them are a little bit unique. The other thing I want to point out is all these presentations were done by students who were working with me. I really love including students on projects and being able to incorporate them into the data collection and presentations and things like that. So they presented on different risk factors and different factors that were driving core temperature. So now I want to shift a little bit and kind of talk about, well, what do we know right now about global warming and specifically like heat wave type based research and how that's impacting human health and especially our communities. And so even though this isn't necessarily like my research that I've been doing, this is definitely an interest area for me to start moving into and contributing to this area, and with the hopes of being able to collaborate. So just in general, when we talk about the impacts on human health, heat-related illnesses and cardiac issues are well known, that they're going to be a potential consequence to rising temperatures and those extreme temperatures that we see. Mental health has also been pretty well established. Part of it is that if an individual already has depression or anxiety, and those days where it's really hot or heat waves, it's worse. So it's exacerbating their mental health. On top of the fact that if they're taking some of these medications to manage some of these conditions, that they might be having more serious health consequences because of that. When we think about who those at-risk individuals are, I kind of mentioned the children and older adults earlier when I talked about the passive illnesses. We also see our lower income, low socioeconomic status communities and our communities of color. Oftentimes they're already overburdened. They may be working multiple jobs. They don't necessarily have resources that will be able to help them. And then sometimes they're just excluded from planning, right? That they're not thought of to be included into that planning process. Other vulnerable populations are outdoor workers, which we'll talk about a little bit in our urban areas as well. Pregnant women from both their health and also the fetus health, and anybody who kind of has those underlying health conditions, which I've mentioned before. Now, talking about workers specifically, there's risks for both outdoor and indoor, and sometimes we don't pay attention to those indoor individuals, or like they're inside, like they have air conditioning, and that's not always true. When we think about factory workers, there might not be air conditioning, or maybe it's broken, the machinery is very hot, so they're standing next to things that are producing a lot of heat. So paying attention to those indoor workers is important. The outdoor workers, specifically, I'll talk about agriculture, construction, and public service a little bit today, but there's a wide range of individuals who are at risk. And then a little bit on the urban heat islands, just for the structure and the built environment in an urban area, it can increase those just energy demands to try to keep things cool. But also it is a little bit of a numbers situation, right? Where there's just a lot of people, and so we're going to have higher rates of heat illness and mortality. But there are some unique factors of that built environment in the urban heat island that contributes to that higher risk. When we look at work-related fatalities, this data from 2011 to 2021, it's the most recent that we have specifically to work-related environmental heat injuries. And you can see a number of deaths that have occurred over the years, and I'm sure that that is continuing to go through up until 2025. It is sort of thought that this is underestimated just due to not having good surveillance and not having good reporting, but it is occurring, right? And so there is this burden that's happening, that not just the individual who's in the general public and at home, but it's happening to workers while they're trying to do their job. Now, construction is particularly vulnerable for several reasons. They're outside, obviously, but think about like the asphalt. So if they're in an area where they're on the asphalt, on the pavement, that's reflecting a lot of that heat energy. If they're on the roof, that is also reflecting a lot of energy or heat. So they're getting a lot of that stress from there. We also see Generally, that lower socioeconomic status, again, maybe the individuals who have some underlying health conditions that are working in these populations that just generally increase their risk. The smaller businesses sometimes may have trouble, they just don't have a big crew, so they're not able to put people out there. They need them to work, and so they're not able to take maybe breaks as much, or maybe they just don't have the resources that they need to be able to help their workers. Agriculture is sort of the original in terms of the research that we have with workers and heat illness. It's been long established that agriculture is at risk for heat illnesses and for a variety of reasons, kind of going back to, again, often lower socioeconomic status. So maybe have other burdens, other challenges that they're experiencing. And then the way that the pay works in terms of like, they need to produce in order to get paid. And so it pushes them to want to be out there and to stay out there. Despite knowing for a very long time that agriculture is at risk for heat illnesses, there's varying policies out there. There's continued to be push for more policies to be able to protect these workers, to get them access to shade and water, and be able to change maybe the pay structure so they don't feel pressure that they have to be out there. I wanted to highlight the fire service. I'm going to come back to this kind of towards the end a little bit. The fire service, both structural fire and wildland fire are potentially at risk for heat illness. Part of it being that they're in a really hot environment, but it doesn't necessarily have to be that. It could be during training. So there are cases of fatalities of fire service workers just doing training and not necessarily specific to the actual exposure to the fire. Part of it is some of that underlying health. There's just stress. And it's very well known that firefighters have a higher risk for cardiac events. That includes things like heart attacks and cardiac arrest. And it's thought to be related to that chronic heat stress that they're constantly exposed to, and also just the stress of the job. And so we do see quite a few deaths, unfortunately, or just heat illnesses in general related to fire service. In a similar way, law enforcement has been something that has been growing in concern. This particular article on the right-hand side, it basically calls for more prevention policies, specifically in our academies, as a number of deaths have occurred to recruits who were performing various activity. It maybe was related to heat, it could have been related to cardiac or sickle cell and things like that, but there has been more call for prevention. Like, we need to do something to prevent these deaths from occurring. In a similar way to the fire, they're under a lot of stress. So there's the stress of the position, that increase in cardiovascular strain. And then similar to the fire as well, when they're in full equipment, they have no choice but to have to wear that equipment from a safety perspective, and that's going to increase their thermal strain. So when we think about what does this cost, so we have individuals, of course, they're having heat illnesses, and well, what does this burden really look like? And we think about it from a public health perspective. This is a public health concern. It burdens the healthcare system, the hospitals, the doctors, everybody who's working there, all of the sort of interrelated systems that are there to support that particular community, but also potentially long-term, if they do have some long-term health consequences. Some specific things that we've seen specifically to human health is increases with the global warming and heat waves, increasing in cardiovascular disease and respiratory complications, increasing that mental health strain as well. And for pregnant women, increasing the impact on potentially like preterm births and just overall fetal health. So there has been tracking over the last several years about the consequences to human health related to rising temperatures. And then this article highlights the cost related to going to the emergency department for this. Both from the person, an insurance standpoint, and the hospital, and the strain on the hospital system. This chart sort of outlines what the impact on workers looks like. So it's not just affecting the employer who no longer has that person working and now has to figure out how do they get this job done. But when you think about the employee who now has to take potentially sick leave, or who can't go, or maybe some other consequences to that lost work time that they have, where they can no longer provide for their family. So it's affecting both employer and employee for a number of reasons. The projected here, 300 billion just in 2010 in terms of heat-related lost work time is projected to continue to increase related to heat illnesses. So there's been a huge push, I'll talk about this in just a moment, from OSHA specifically to try to work on prevention policies. Like, how do we prevent this from happening so that we can decrease this impact on workers? The burden on the healthcare system. So when you think about during a heat wave, the hospital is prepared for its normal everyday activities, but during the heat wave, it's going to have an influx of individuals who are coming that normally wouldn't. And so these individuals are coming with heat-related illnesses that they now have to care for. In the time frame here are 2008 to 2020, over 1 million heat-related emergency department visits alone. And you can see while the largest part was in the south, there were several thousand that occurred every year in the Northeast. So this is a concern across the US and really across the globe. The burden on the workforce and first responders, the higher the temperatures for the day, the more likely the police and fire are going to get dispatched, and not always for fire. It's usually medical issues. So over half the time it's for medical concerns related to the heat. There are lots of studies documenting the death toll, fatalities during heat waves, again, across the globe. So we definitely know that this is a great concern in terms of life loss with heat waves, and the potential long-term consequences, again, if that they don't get managed appropriately. If this individual experiences permanent organ damage or things that are going to affect their ability to have a good quality of life or to be able to work in the situation that they were before. This particular study just highlights 6 different issues, but it highlights one particular heat wave and just the cost of that one heat wave alone, in terms of the healthcare system as well as just life lost. I mentioned this, the OSHA has recently come out with their kind of a bigger attempt to try to prevent heat illnesses. Like, how do we protect workers? They've had some pretty standard, like minimal workplace standards to try to limit heat exposure. These are some of the hearings came out recently to talk about, these are some essentials that need to happen. So looking at conducting regular risk assessments, having mandatory prevention plans, acclimatization program, sort of like what we talked about with the marching band, right? So how do we acclimatize individuals to their work? Sometimes somebody gets hired construction and then they just go out there and work, right? And they're maybe not ready to be able to participate in that construction work, in that demand, or if it's fire and police and they're in the academies, maybe they're not ready to be able to perform that activity. So how do we acclimatize them? So medical monitoring and response, and then maintaining appropriate data. We don't necessarily have federally mandated prevention programs yet, but that's something that's sort of a goal. Like, we want to be able to produce that and have that out there. The other thing we want to do is encourage heat action plans, and that's from a community standpoint all the way up to a state level. So what should the community be doing? Who are the different stakeholders that need to be involved in those conversations to be able to have a heat action plan where we're issuing warnings, we're giving people resources, like where can they go to be able to get healthcare or to get fresh water or to get cool, where are there cooling stations that they can take a break and they can get out of that heat exposure. The other thing from a prevention standpoint is making sure to include our vulnerable populations, maybe our rural areas that don't have access to different resources, but do we have education going out? Do we have somebody checking on these populations and making sure that they're okay? So that leads me sort of to this potential collaboration in areas that I see potentially working with individuals here. So what's awesome about Maine is that it really is so forward thinking in its efforts to address climate and some of the things compared to some of the other states that I've looked at and where they are. So first of all, I would just say that I would appreciate the opportunity to be just a resource and a collaborator. If you're interested in human health impacts, whether it's heat or cold or primary care, like other underlying health conditions, mental health, I think that I could be an individual to help with that human health aspect. The other thing I think that would be interesting is to identify some of those risk factors, like continuing to gather more information. The more that we understand about why people experience heat illness, the better our prevention can be, the better education that we can provide to them to say, hey, these are some of your risk factors, these are things you should be paying attention to, and this is how we can help you. The Maine Climate Council has this statement that they've issued in their latest report, just about acknowledging the rising and increase in extreme heat and the heat illness issues that are going to be taking place. And the Maine tracking network, which has this really awesome I haven't seen this before, but such a great thing to have about the real-time emergency department visits, and you can see like that heat, right? The times that they're going during the summer times, usually the number of cases that are occurring. So this is stuff that's happening, and being able to dive into that data a little bit more, try to understand what some of those risks are and how can we prepare the communities. If we know that this is the time frame of the year that's coming, how can we best prepare them? So really great opportunities to work on action plans at community levels and to really help educate the public as well as the healthcare system. So most hospitals aren't really set up to handle heat stroke. That's just not something that they typically have to do. When we think about an athletic standpoint, we always cool them first before we ever let them leave. That's sort of the mantra, cool first, transport second. Like we cool them down and then we let them go. And that's because generally the hospitals aren't set up to be able to handle that. So being able to maybe work with the healthcare system and look and see what are ways that we can help them prepare. At South Carolina, I had a really great opportunity to teach a course related to climate and human health. It was at the honors college level, and I've taught a grad class at KU related to environmental physiology and sort of the impact on human health. But I would welcome an opportunity to, whether it's guest lecture or offer a course to some degree. My department that I've talked to is open to having some kind of collaboration and working together to be able to offer something related to human health. And it doesn't necessarily have to be just heat, it could be climate in general. The bands that I've talked to, they're like, oh, heat's great. Like, thanks for looking at heat policies, but when are you gonna do cold policies? They're like that. So sometimes the worst piece of it is how do we get them warm? And so I told them, I was like, okay, well, let me do the heat policies first, and then I'll come back to cold. So it is definitely something on the radar to look at the issues with cold. And how do we help individuals, again, just in a similar way, right? How do we limit the amount of injuries that are happening and all those negative consequences that happen when they experience cold-related injuries? So definitely interested in that piece of it and hoping to be able to move forward with that. And the last one that I'll talk about is something that has come on my radar since coming here. I've had the great opportunity to work or talk to some colleagues in my department. The New York Times put out this article a few weeks ago about the wildland firefighters and them not wearing masks, basically because of requirements and standards that have been put in place. They clearly, from breathing in the smoke, have been experiencing high rates of cancer, lung disease, things like that. So they get sick, they're dying. And so this investigative journalism was trying to raise awareness about these concerns. Some of the pushback about why the wildland firefighters specifically are not required to wear masks is this potential risk to overheat with wearing the mask, and that it will reduce their work productivity. So I'm planning to submit a funding proposal in January to try to fund a study to investigate this and look at physiological responses of these individuals while they're wearing their masks and see what we find. In an effort to try to, I would like to hope to advocate for the fact that they can wear masks without having detrimental effects on their physiology. And if we do find that it's affecting them, well, how do we compromise, right? Like, how do we allow them to be able to wear a mask while still being able to be productive and limiting that risk to having a heat illness? So how do we find some compromise there, depending on those results? So excited to hopefully potentially move forward with that. I'm gonna ask my presentation. Thank you so much for coming and for being here.
Thank you. Well, I see there's a question out there. Go ahead.
Question I have about apps. So nobody really developed anything that tracks like in real time, something that capture, let's say from Garmin device, some kind of
For temperature?
Yeah, something, and then produce like a, I don't know, match for the local temperature.
Yeah, there's a lot of technology that's out there. There's a lot of options. So from a research standpoint, we always use core temp pills. They're pills that they take, it sits in their gastrointestinal tract, and then we can read and see what their core temperature is. So that is an option for some individuals. So if you wanted to do monitoring, right, like if we had people who we wanted to monitor, we could do that and we can keep track of them. The temperatures that you get from like Garmin devices and other technology that's more surface, it is a surface temperature, it's a skin temperature that they try to then come up with whatever magic formula that that particular company wanted to come up with to then predict like what that person's core temperature is going to be. So it's not as accurate, but it could give you some indication. There are a lot of other technologies, things that you can wear in their helmets, things that you can wear on the skin surface, but they're all rough estimates based off of the temperature that's on their skin, not necessarily what's happening to their core. But from a prevention standpoint, they can be useful to say, okay, well, you are getting close to this like hot point and this sort of cutoff point, we need to let you go rest. So there is quite a bit of technology out there to at least help from a prevention standpoint.
Okay.
Mhm. Yeah.
You brought up a lot of interesting questions related to, or issues related to human health and heat. Maybe you could talk about cold too, but so there, that suggests there must be some major sources of funding available for research on this sort of thing. What are some of the ones that you would anticipate using during your career to get funding for your work?
Yeah, thank you. Well, when the NIH wants to fund climate, obviously that has been like an initial interest. What I have been looking at recently, particularly like this like I want to apply for this stuff for the wildland firefighters, is foundations. So foundations who are interested in human health specifically and the impact of climate on human health. So that's predominantly where I've been looking right now, is to try to explore some of those funding routes. I mean, federal funding is always great, but I think right now everybody's sort of shifting to which foundations are going to help us get our research done.
I think Dan has a question
Oh.
too. Dan, if you want to go first, then I can go.
Okay, thank you very much. So this is sort of an off the wall question. I'm an archaeologist, so I'm interested in people of the past. I'm wondering if there are any skeletal indicators of heat stress or recurrent heat stress, or are they all in the soft parts that generally don't preserve?
You have stumped me. I know of nothing in the bones, skeletons that would indicate that. I would imagine that most of the damage occurs to the soft tissue, but I actually don't know if there's any permanent damage to skeletal. I have not seen anything related to that, but that doesn't mean it doesn't exist.
Well, thank you for, that's sort of what I expected, but it might be worth taking a look at.
Yeah, now I'm curious. I'll go look it up.
Thank you.
Thanks for a great talk and welcome to Maine.
Thank you.
We're happy to have you here.
Thank you.
You anticipated all of my questions. All of my question marks are taken, except for how hard was it to get IRB approval to work with HBCUs on health related issues?
Oh.
That's been difficult.
Actually didn't have that much of a hard time.
Oh, good. Oh, that's great.
Yeah.
Good.
I think maybe just the place that we were at, my husband worked at an HBC, my husband's an athletic trainer, and so he was also associated with HBCU. I think having worked with quite a few individuals, like how to approach it, right? Like how, because it can be a little bit difficult just given previous history of research and that population. But I think we're all just very aware of that and being appropriate with how we approach it. And so we really didn't have an issue, but that's not to say that in the future we wouldn't.
And that's awesome. It means you knew what you were doing. So, but I did just have a couple of comments. I think it's really exciting the work that you're doing. And I just wanted to tell you that I'll email you, but I'd love to connect you with a couple of people that you may already be aware of this, but at Margaret Chase Smith Policy Center, they have a big research project focused on Maine firefighters and wildland first responders. So that would be cool to connect you in with them.
Yes.
And then good job doing your homework on the Climate Council and the work they've done. But if you haven't been introduced yet, I'd love to introduce you to Rebecca Lincoln at TDC, who's the person behind a lot of that.
That would be great. Thank you so much.
Yeah.
I think somebody commented on, if you want to.
Are there any other questions or comments? If not, Dawn, thank you very much. That was really interesting. I'd like to get together with you to talk about some other stuff.
Okay.
Out of that, when you have a chance.
Thank you so much. I appreciate it. Thank you all again for coming. I really appreciate being here and talking to you.
Yeah.
Thank you.
Have a good rest of your day.
Thank
And
you.
reach out to set up an appointment sometime soon.
Thank you.
Take care.